Good evening. This is an important week in British Columbia as Phase 2 of BC's reopening plan begins. I want to thank all physical therapists for their cooperation and patience over the past 2 months as COVID impacted our patients, our profession, our families, and us as individuals. It has been a challenging time, and so far we have gotten through this together. The next weeks and months are also critical in the provincial management of COVID. As has been communicated to you by the College, the direction of Dr. Henry and Minister Dix is that they expect a gradual return to work, especially for community providers, knowing that there will be a new normal in our work and professional lives. We don't know exactly what this new normal will be, however, but we do know it will be different than our past. I encourage all physical therapists to take the time you need to prepare for this gradual reopening. Continue to provide virtual services whenever possible. Implement COVID screening protocols for all patients, and don't allow any staff or patients to enter your practice if they are ill. You will need to use your clinical judgment to triage those patients who need urgent or essential in-person services, and understand the expectation that these services may be 50% or less of pre-COVID capacity in order to maintain physical distancing and to ensure appropriate infection prevention and control protocols. Caseloads will look different to meet those requirements set out by the BC CDC and WorkSafe BC. The college staff have received many questions about personal protective equipment in community settings. As reflected in the guidelines sent to you last Friday, rather than a directive for mandatory PPE for asymptomatic patients, the BC Centre for Disease Control currently requires health professionals to use a point-of-care risk assessment to guide their clinical decision-making. This may be different than in other jurisdictions. However, public health experts have drafted guidance for you based on the latest available best practice and scientific evidence. This allows you to use your judgment and requires you to do a risk assessment prior to making decisions about the use of PPE. It is important to remember that PPE is considered the last line of defense and must be used in combination with more effective environmental, administrative, and personal measures to protect against COVID-19. This direction from the CDC may change as we learn more about COVID-19, and as information about PPE becomes available, the college will share it with all registrants. On behalf of the Board of Directors and staff, thank you again for your contribution to flattening the COVID curve. We will provide updates as they become available, and thank you again for your cooperation and all you do for the health of British Columbians. Stay safe and be well.